Well, hello, everyone. Today we have with us Amanda Peters, and Amanda is the director of the Northern Kentucky Office of Drug Control Policy. Amanda, thanks for giving us some of your time today.
Thank you for having me.
Well, first of all, many people may not even know what is the Northern Kentucky Office of Drug Control Policy. So fill us in. What is that? What is the organization all about, and what is its mission?
Okay, so what we are is, you're a board of 7 folks, and so that's who provides me oversight. So of course you, and then the 2 other judges executives of Campbell and Boone County, Garen Colvin, St. Elizabeth CEO, also Kris Connors of the Northern Kentucky Drug Strike Force, Lynn Sadler of the Health Department, and then Kim Mosier as our legislative liaison. So this board provides me oversight to put together a regional response plan, as well as we oversee the addiction helpline for Northern Kentucky, provide a data dashboard, and then also provide some diversion support for our partners in the region.
And you're housed at the Northern Kentucky Area Development District, correct? And so back office support there. So obviously shout out to Lisa Cooper and her team there and that board that allows us to partner with them as well.
Yes, we couldn't do what we do without their support administratively and organizationally.
And so Amanda, A, how long has your office been around? And B, maybe speak to all the agencies. I know there's a multitude of agencies that you work with on a daily basis to coordinate the efforts that encompass the daily work that your organization has.
The board came together in 2015 officially, and then expanded in 2018. After my predecessor, Representative Kim Mosier, really took charge of this issue. And as she went to fight the efforts at the state and national level, that left a gap for local efforts where I was able to step in.
Go ahead and speak to the organizations you partner with.
Yes, so some of the partners that we use and talk to every day are Transitions, Sun Behavioral Health, of course, St. Elizabeth Healthcare, St. Elizabeth Physicians. Those social workers are just so important to the work that we do. Journeys of St. Elizabeth, their outpatient program. We also partner with our social service agencies, Welcome House, Brighton Center, Community Action Commission, Life Learning Center. There's just so many that takes to get folks on the path to treatment and recovery for lifelong disease management.
And it seems like, Amanda, if we go back pre-COVID, we were daily thinking, seeing the work that Northern Kentucky Hates Heroin was doing, all the community efforts of saying, hey, we've got this problem with heroin addiction or addiction in general in the community. Partners were just watching all this amazing work, and people were dying. And so we were all standing up saying, hey, what can we do to save people's lives, hopefully, and get them on this pathway to a recovery. And now COVID has kind of taken the primary place of that. Does that mean that where are we with addiction, overdoses, and deaths, et cetera? And does that mean that problem was solved?
Well, I want to start by saying that Northern Kentucky is really at the forefront of this issue. We lead the state in a lot of ways, and we even lead the nation in a lot of our efforts. And from 2018 to 2019, we're really seeing a decrease in overdoses that were fatal and non-fatal. Lots of community partners coming together, lots of grant money coming into the region to really look at a holistic approach to taking this issue head on. But since COVID has hit, we have just seen such a drastic turn. All the things that we put in place that are revolutionary to this response has kind of been shut down in certain ways. And a few examples of that would be Northern Kentucky was really enjoying almost an on-demand treatment kind of environment pre-COVID. But due to the health issue, we have to have screenings. We have to just do some different things. The recovery meetings look different. There's less access for people. And with addiction, that window of opportunity can sometimes be short.
So to the outside world, if those who may not be dealing with any addiction in their world, this world looks different, because if I would have been able to send somebody to treatment before, there may be barriers that maybe force that person to maybe feel a little bit more isolated and maybe not want to get treatment. Is that what you're saying as well?
Absolutely. You can't call on a Saturday night anymore and get into treatment, because we need healthcare professionals to make sure we're screening our folks into into treatment. It's not as quick to get an appointment for outpatient. Folks can't connect with their recovery networks as quickly as they were prior to COVID. So it's just been a lot of barriers where folks can't get where they need to be. And then some additional barriers have been the homeschooling, which we know we have to be healthy at home and take the virus seriously. But unfortunately, for many folks, they're not able to go to treatment. They're not able to access that because they have different things at home. And the one thing we do know about addiction is that it's a family disease. And this is affecting so many. And so it's just harder to reach some of those families because we don't have those intervention points at school either.
So the lack of connectedness, and then I guess the simple additional stress that is on families, because we know it's not just addiction, it's not just an issue for someone sitting on a street corner or something, that they're just can't quite get the access that they might have gotten pre-COVID, I guess. So speak to the amount of overdoses. What does the data look like there, and what does the data show you from the helpline that you're getting calls on?
We are seeing increases from the overdoses. We are seeing them from the fatal and non-fatal side. We receive dispatch records from Boone, Kenton, and Campbell counties. We've been getting them for quite a while now, and we are seeing them trending back up. And from the fatal side, from the Office of Drug Control Policy and our partners at the Kentucky Injury and Prevention Center, they're seeing a 25 to 30% increase for preliminary data on fatal overdoses. And some of these have to do with fact that folks in long-term recovery are relapsing. You know, this virus has really invoked a trauma sense in the body, and that it has folks with mental health issues, just from anxiety and depression. You know, folks go to cope where they know how to, and for a lot of folks, that's substances. So unfortunately, we've seen an increase. So our data is showing that it's happening on all levels, and then we're getting more calls from the helpline for folks needing complex situations. They just need so much help in so many different areas. We're trying to figure out, how do we stabilize the situation? Can we get them into treatment? What do we do with their children? But also an increase of calls where we have to actually alert the authorities for distant situations with the children in the home.
So speak to the issue of addiction, the actual, I should say, the drug of choice, or what you're seeing there. Heroin was the main topic, it seems, going back a year or two ago. I think, from my understanding, that's changed a bit, and maybe even talk a bit about what that transition has looked like over the past, let's say, 18 months or so.
We've seen an increase in fentanyl. Fentanyl has been around in our region for a while, but we're seeing them, the toxicology reports are providing more and more fentanyl in the fatal overdoses. But coupled with that is we're seeing an increase in methamphetamines. And an overdose with the methamphetamine looks very different. There's not as many interventions. We don't have Narcan. We don't have medicated assisted treatment to help these folks along their path. It's just a little bit different therapies. So when they're coupled together, we're triaging these cases and trying to look at it at all angles. But with the methamphetamines, we're also seeing an increase of hallucinogens. So acid, some other forms are coming into the region. And what is interesting when talking to the Drug Strike Force last week is that we're seeing a decrease in supply. And so that might have to do with some different international borders, the drug supply coming in from Mexico because of COVID. So we're seeing drug prices go up for the first time in a long time. So we're hoping to maybe leverage this with doing some more outreach, where we're going to knock on doors again. We're trying to go to our community partners and get the word out that treatment is here. Because as folks start to withdraw from these substances, or they have a lapse in trying to get their supply, there might be a window that we can, get them the level of care that they need.
Well, and we can literally talk about the nuances of this thing for hours, but I guess to give Northern Kentuckians a sense of both facts and some hope, we have the helpline available, which we'll post here on the screen. We'll also make sure that, I guess, the concept of this, all the agencies really coming together unlike ever before, and really it's been going on for the past number of years, from the detention centers all the way to recovery centers and partnerships. But if somebody had an issue today, there is a bed available, there's detox available, there is a way forward to get partnered with an agency somewhere along the way, and you can help them get that connection to help they get them on their way to recovery and hopefully better success with their life.
Absolutely. Especially when it's a Monday through Friday, which we know folks don't always reach out and need help at that time. But Monday through Friday from, 9 to 4 kind of hours, we have on-demand treatment. You can get an assessment done almost within hours. There's a bed open at transitions. And something neat that they're doing is they're really evolving addiction to a disease model, the way it needs to be. And so they're taking the words of detox kind of out of the equation and
Okay.
looking at withdrawal management. But there are options for folks that are looking for that traditional detox. We have partners around the state that we work with, but we have cut state-of-the-art cutting edge treatment on demand, beds open today, ready to go if somebody wanted the treatment. There's also options for medicated assisted treatments for buprenorphine shots, Vivitrol shots, different ways to help so they don't have to go through the withdrawal of their life. They can get help right away, ease these symptoms, and let their brain start the rest. Most of our folks are in fight or flight. Their brain has been hijacked. They can't make the decisions from their frontal cortex not being healed. And so those medicated assisted treatment drugs let them rest so they can start making decisions again. Their brain can start coming back and to be able to be in a place where they can accept that treatment and move forward.
Well, I think your message is there's a lot of opportunities, and we should be we can be hopeful that the track we're on is better and better every day. One last point I would ask you: where are we with the idea of this, the topic of stigma? Speak to that a bit. What is your thoughts on where we are today? Stigma for those who are in addiction, et cetera.
Stigma still exists. It's not at the same level, and organizations like Northern Kentucky Hates Heroin, Casey's Law, some of the others that have been in this fight for over a decade have been working towards this. We also have a situation where I think Nancy Hale of Operation Unite says that there's not a child in Kentucky that's not affected by this in some way. So whether it be their immediate family, a friend or a neighbor, or even extended family, everyone is affected by this. And once it starts hitting closer to home, people start understanding, do people make the best choices all the time? No. But we know people are the expert in their own lives and do the best of what they can at the time. And if we can provide them resources and the health care that they need, we can get them to lifelong recovery.
Well said. Amanda, thanks for your work and all the work and all the partners. And I think it's just great to see the improvement that everybody's getting. We seem like everybody's evolving with this effort in Northern Kentucky. And thanks for all your great work in that area.
Thank you, Kris.